You know, as Americans age, they're increasingly dealing with multiple chronic conditions like diabetes. In fact, almost 40 million Americans have diabetes right now, and as a result of that, they're at risk for developing a long list of other chronic conditions. This is straining the traditional healthcare system in this country like no other. Dr. Shaminder Gupta, a practicing internist, nephrologist, and chief medical officer at Monogram Health, is here to discuss a revolutionary holistic approach to chronic conditions. Thank you so much, sir, for being here and being a part of the show today.
Good morning, Montel.
It is crazy. I mean, we were just talking a little bit before we started. Chronic diseases are impacting Americans at an alarming rate. It seems to have gone up, but is that true? What's going on?
Well, we are living longer, which is a good thing. But with living longer comes more illnesses. You know, diabetes and obesity continue to increase in our country. And with that, we see downstream illnesses, particularly in areas of heart disease, kidney disease, and lung disease, which requires more specialty care. So for each disease you get, now you have a doctor you got to see, which is a big stressor for seniors in particular.
And what does this mean for our healthcare system, the current healthcare system overall? What do you propose has to change to help?
So when patients have multiple chronic conditions, a heart condition, a lung condition, a kidney condition, it's really important to try to provide that care more holistically through a singular provider who knows more about that patient and the different disease states. It eliminates these extra visits. In my practice down in rural Louisiana, I saw this firsthand. As a nephrologist, kidney specialist, I saw patients who also had heart disease, lung disease, and it was a requirement for them to do better for me to be able to take care of all these disease states. So bringing that level of care to the patients, particularly in the homes with the understanding of other things they might need, social needs, pharmacy needs, really allows that kind of model care to be delivered to take care of these patients.
But now, aren't some of these services already being provided by hospitals now? They're trying to keep up, right?
Yeah, they certainly are, but they can't keep up. Imagine a world where the patient is dictating when their appointment is, not the doctor's office. Imagine a world where the patient is being seen by a provider who can provide care across heart, kidney, lung, diabetes, and have that caregiver present. All of a sudden, that husband, that wife, that child who's in the room with them understands what's going on with mom or dad and can really be part of that solution. So that is where we need to get to as a health and aspire to have that sort of level of care, which I think we would all want for ourselves or our loved ones.
Sounds a little expensive, huh?
Well, actually not doing it would be expensive. So we work with the largest insurance providers, including Medicare Advantage providers, to bring this complex population the highest level of care in the home. That's what keeps costs down, being proactive versus reactive.
Dr. Gupta, you've been a practicing physician for 20 years now, so why switch to Monogram Health now?
Yeah, you know, my journey's been an interesting one. I'm born and raised in Louisiana. I had the privilege of practicing in rural South Louisiana for over 20 years. And in that experience, learned that you just can't be a nephrologist. I learned very quickly that you have to be able to provide care to these patients wherever they need it and how they need it, which meant going in the home sometimes, which meant meeting families sometimes, which meant meeting them where they are, in essence. You know, I've had patients bring me food, gumbo, desserts, because of the relationship I have with them and their families. And I think that's very important, which has shaped the way I look at the world and how I think care should be delivered. It's really kind of bringing it back to the old-fashioned country doctor way, but a little bend toward specialty, you know, where you're actually really owning that care and being part of that patient's experience from start to finish, and more importantly, being a trusted call for them. They know that if they call you, you can handle what they need, not send you off to someone else.
Let's take a look at some of the comments that a couple of your patients had to say.
I never went to a doctor in my life. I just work all the time. So I neglected high blood pressure, my diabetes, and that's when my kidneys started to deteriorate. And I saw Dr. Gupta at the time. He's a character. I really enjoy him. He talks, if you need anything, he's going to help you. He wants you to get the best treatment.
We're very grateful to Monogram and Dr. Gupta, honestly, for where we are at this point. I mean, Dr. Gupta and y'all, Monogram has done just so much for us. So the little bit we do is really nothing in comparison to what y'all do.
Wow. They seem to really enjoy this, my goodness. So where can our viewers go if they want to get more information?
So you can find us at monogramhealth.com, or you can use our social media channels, so visit us to view patient stories and experiences.
Excellent. Look, thank you so much for being here. So great information.
Pleasure.
For sure.
Thank you so much.
And of course, if you want more information, you can always go to our website, thebouncingAct.com. We'll be back right after this. Right, again, thank you for being here.